we select this 100 person should be the corporation body, either the training department or the head office. Somehow that will break the relationship between the candidates who will attend and between the influencing or the supposed to be influencing drug company. This is what is happening in some places. But we should all revert back to the land law and the corporation policy in this area. And if we don't have a corporation policy in this area, we should go and ask for it. We need to have a policy for this, and we should go to ask for it. Is there anybody who wants to add a comment, or I should move to the next one?
So there's confirmation that the company would need to look after the conflict of interest. So a policy would need to be developed if there isn't one.
Yes. If we have a policy, then the problem is solved. If you don't have a policy, then you talk to the right people. Please, we need this policy. Okay. Okay, can we move?
Yes.
Okay, here we have ethics struggle is going to be between what is right, what is wrong, what is moral, what is immoral, and just and unjust. So these things will be guiding us on what to do in this area. Our code of ethics should be looked after. The code of ethics should be by all the members of the group, okay, who were invited or who are involved. And this should reflect, what we do should reflect our moral judgment over time, and this should serve as a standard for the professional action. This is some sort of guidance for the policies that is expected to come. And ethical issues that are coming here is veracity. Veracity is needed from the drug company, because the company is not going to invite you as tell, I don't want to influence your ideas or your understanding of the drugs. I cannot believe that. They always want to influence people. Privacy and confidentiality, this is not an issue to be private or to be confidential. If somebody is going to attend a conference at the expense or at the cost paid by a drug company, he should declare this and make it clear to his colleagues. And this should be arranged through a certain way. Okay, and we have role fidelity, we have professional responsibility, and we have autonomy to attend or not to attend, but there is professional responsibility to the profession and to others. We have to respect our societal institutions, the ethics bodies that's working in the country, and we have our culture, our life, our family, our religion, all of these are involved here, and they will affect our decision. Also, the integrity and nazaha in Arabic, it may be injured by accepting this if we do not do it the right way as it should be. Okay, take a breath. I'm going to take you to another problem. Okay. A company for physiotherapy equipment is inviting you to their new showroom. What is your ethical guidelines or guideline here? Do we have physiotherapy people here? Do we have lab staff here? The people who buy and use equipments.
We have physiotherapists there, yes.
We have lab technologists or technicians?
We do, yeah.
Okay. So what is your ethical guideline? Do you have guideline here?
So again, refer to the conflict of interest policy.
Okay.
Seek approval from the line manager.
Okay.
What else is being said? Understand the purpose of the visit. So seek more information regarding the visit.
They want to show you new equipment, and possibly if you are convinced, then you tell your corporation to buy these. Are going to show you the latest in the world, the top in quality.
So yeah, the majority of the answers are referring to the conflict of interest policy of the place of employment.
Okay, will you go or not?
So it looks like most people are saying it depends.
It
It
depends.
depends on the policy.
Okay. Do you have any guidelines to handle this? Handling the new equipment or equipment you have?
So it doesn't look like our attendees are aware of any guidelines in their place of work regarding this.
Okay. We have something called ME-COMIT. This is the Medical Devices Imaging and Diagnostics Trade Association, and it has many guidelines to underline compliance with the following laws and regulation as having relevance to the medical technology industry. This is one of the good books, okay? It's the right corner here. Can you see my cursor moving?
Yes.
Okay, this one, and this is a book actually. It has a lot of things related to handling devices and imaging and diagnostics and lab materials, all of this. And when you go to attend something like this and you're going to later advise your corporation or your gym or your lab or your department to consider something, you have to consider the following 6 things. Number one, the safety, quality, and performance laws. Every country have its laws, and every equipment will be under certain laws. Advertising and promotion laws, are they following the right way of the laws, the land laws in this country? Are they protected? Are the data protection laws observed when these people are doing these things? Okay. What about the anti-corruption laws? Because here, always people are talking about commissions. Okay, when there is a big contract, always there is under table money and there is commissions. But to fight this, there is anti-corruption laws. And also there is issue of environmental health and safety laws to the building, to the people, to the equipment, to the population. And also there is competition laws that needs to be observed. So if you are going to go and be involved, you need to refer to this book and other similar books, and you'll be aware of these areas and the laws covering these areas before you go there and find yourself entangled with the law or with something else. For our lab technologists, okay, they have the code of ethics plus ME-COMIT, and they have this one. They have to maintain strict confidentiality of the patient information and test results and safeguard the dignity and privacy of the patients and be accountable for the quality and integrity of clinical laboratory services, and this includes the machines. Okay, so if you go to the International Federation of Biomedical Laboratory Sciences, they have this code of ethics, and this number 3, it accounts for all the clinical services and all the lab equipments that you get to your lab should comply with the previous laws of ME-COMIT. Okay, so nowadays I can hear that some people are trying to buy new lab equipments for COVID or for the next coronavirus, and so all of these laws should be observed when you are doing this. Why this became laws? Because this is dealing with money. Dealing with money, you will find the ethics are coming first in the front, but immediately 1 centimeter behind, there will be the law. Okay? Okay, take a breath, take a brief rest, and then we go to the next. Okay, Zina. Zina, do we have nurses today?
We have lots of nurses today.
So Zina, the new nurse, is asking you to help her to do a great deed for two families in the local community. Mr. Ahmed, a widower with 5 children, is looking for an infertile woman to marry. He doesn't want any more children. He already has 5. Miss Dahlia got divorced recently because she was discovered to be infertile. He asked the help of our new nurse to find that lady. This is one of my cases, my personal cases. It happened to me, I think, maybe more than 20 years back. Okay, so Zina came and told me, Mr. Ahmed is a widow. I know him and I know Dahlia. I know both of them. So she came and spoke to me about that. My question is, what are the issues raised by the request of Mr. Ahmed?
So our first response is this could have implications, breach of patient confidentiality,
Okay.
patient privacy rules. It's not a very professional conversation between a patient and a nurse. Disclosing confidential information. Okay. Yeah, so it seems to be the issues are around disclosing information.
Okay.
And breaching confidentiality.
And breaching of confidentiality. What are the issues raised by the request of Zina? Could be the same things raised by Mr. Ahmed, but there should be some more.
So Ahmed has said that this is involving herself in the private life of her patients.
Okay.
And similar, Lubna has said that she thinks finding him a wife is a primary healthcare center's responsibility. So similar.
Thank you, Lubna.
And Inas has said that she is involved in patient personal relations and issues. Yeah, so I think it's around, involving herself too much in the patient's private life and personal issues.
Yes. Okay. What is happening is that for Zina, the main issue which is raised by Zina is the need of proper training for newcomers. Yes, Zina. She has a goodwill. Maybe she's a very honest person, very respectable person. And this is what has made Mr. Ahmed to trust her and ask her this question. Okay. Maybe he has some rumors in his head that Dahlia, this is a local community. Maybe he heard that Dahlia was divorced and he just want to confirm that. To take you to the real story, at that time I spoke to my nurse, which is now I'm giving her the name of Dahlia. I told her, Dahlia, let us revise our ethics. And we went to the Code of Ethics of Nursing and we spoke about many things. And I told her what you should do if somebody asks you this question. You tell him, I am bound to the code of ethics. The code of ethics does not allow me to do this and this and this and this. And I cannot help you at all in this area. Okay. And I cannot give you any name. I cannot look into the file of any patient. I am not allowed to check patient information. If I know information, I will not speak it to myself. Okay. Thank you, Mr. Ahmed, for your trust on me. But please understand this is the ethics. And if I break the ethics, I will be breaking not only the ethics, I will be breaking the ethics and the law. This is a very private matter. And you cannot find anybody in the health center who will help you in this area. Actually, Mr. Ahmed, after that, I gave him this name. He came to me after she returned to him and spoke to him. And he came to me, he said, you, Dr. Isam, are part of our family issues committee. Actually, we were in a compound, which is a military compound. It is composed of 1,000 families, and I was running the family counseling clinic. And I used to get the help of the imam of the masjid and 3 or 4 of the big men, age-wise and position-wise in that area. This was in one of the Gulf states. I won't tell which one. So we were in a committee that will help if there is a divorce, if there is family disharmony, if there is children are being bullied or bullying children, or if there is any social problem in that community, we used to go for counseling of the family. Sometimes we counsel the students in the schools, or we counsel the parents, because we can meet the parents every Friday in Salatul Jummah. And I used to give small talks in that as part of my health education program. And sometimes, based on their request, we talk in different issues in smaller groups. So I told him that the law says so, the ethics say so. He said, but you are part of the family community, the community and family group. Then that's another level. We should not talk about it within our building. This building is bound to law. When I see you in the mosque, we can talk in another way. And when I went there, I advised him to go to the khatiba. The khatiba is a lady who facilitates the fiancé arrangement and this thing in that local community. And I told him the khatiba may help you in this area better than me and better than anybody else in the health center. Fortunately, he went, he spoke to the khatiba, and he told the khatiba his intention. The khatiba went and visited 5 or 6 ladies, and she managed to select the right lady for him. And I attended the wedding of this family. So my advice was, go and speak to the khatiba, and the khatiba will find a way for you. So I did not breach the confidentiality. I did not do anything wrong. I did not break the law, but that's the way it is. This is a very rare incident. But let us go to our area. Yes, I want to help Mr. Ahmed. I'm very empathetic with his condition. He has 5 children and he needs a wife to take care of them. In his community, sometimes the second wife will beat and will mistreat the children of the first wife. So he has good intention. I am with him if he believes this way, and if there is a lot of incidents around him. So he would like to do that, and this is his autonomy. I respect it. But I have to be fair with other people. I have to be fair with the women whom I have their confidence. I know their secrets. The second thing is that we want to respect for persons. Respect of person includes 4 things. As we all know, it includes respect for autonomy, respect for confidentiality, truth-telling, and informed consent. I cannot tell Ahmed about Dahlia without the truth telling of Dalia of what is going on, and without getting her informed consent if somebody is going to take that risk. I wasn't brave to take that risk of informing Dalia that there is somebody looking for a lady like you, and he approached me, should I talk to him or not? This is an option, and some people could justify it, but I don't want to put myself in that. If any complications came, then it will come to my head and will hit me very hard in my head and my heart. So I kept away. So always beneficence should be there and non-maleficence should be there. Beneficence for Mr. Ahmed and for his children is always respected, but not as the expense of non-maleficence to Miss Dalia and her family, or at the expense of my respect to my profession. Again, also, we should always observe the land law, and we should always observe the corporation policies. Okay, if you work in health facilities, there is always corporation policies on handling these things. This is very essential triangle, and we want everybody to observe it in whatever you do. And they are always moving, working together, and always please remember. Actually, this diagram or this triangle works for all the medical professions. It works for all of them. There is always issue related to justice, equity, and fairness. The issue related to beneficence and non-maleficence, and the respect of person, which includes autonomy and the confidentiality, the truth-telling, and the informed consent. Okay, we move a little. Miss Reed, a 67-year-old lady with recurrent attacks of gout. She has hypertension as well. She met the dietitian, Miss Sajina, who advised her to become vegetarian. Sajina is vegetarian and used to advise others on it. She showed Miss Reem evidence that vegetarian food is the healthier option for all. Miss Reem, she got very angry and came complaining that the dietitian has insulted the traditional food and she should be fired. What are the issues raised by this situation? Do we have dietitians with us? Hello?
We have 2 dietitians with us.
Oh.
Okay, so our responses are coming in. It seems as though Miss Sajina is attempting to put her values on the patient. This is a poor example of patient-centered care where the patient's values are not being respected. It's a problem with communication rather than anything else. If she had counseled the patient using different take on the issue, the outcome would be the same and the patient may not be angry. Okay. So Ahmed is saying that vegetarian food isn't not the healthier option for everybody. So she's giving incorrect evidence. So Ali has said Miss Sajna should respect the values of the local people. Okay, so yes, so we're receiving similar answers here now.
Okay, this is great answers. Should she be fired? Nobody commented on this. Bisrim is asking.
So four people, 5 people are saying not at all. She should not be fired.
She should not. So what should we do for her? For Sajna?
Training.
Yes.
Investigation as to why she's making these recommendations.
Yes.
So it's mainly training and in investigation, a thorough investigation to find why she's making these reasons. She should be, and she should also be trained on the local culture and cultural competence. She should be trained in cultural competence.
Great answers.
Okay, and she should be Ms. Sajna should be made aware of other resources that can be given to provide patients with evidence-based information.
Great answer. Thank you all for these great answers. Okay, let us go there. We have the International Confederation of Dietetic Associations, and we have also the International Code of Ethics and Code of Good Practice for them. This is okay, eat right. There is International Code of Ethics that the dietitian practice in a just and equitable manner to improve the nutrition of the world by being competent, objective, and honest in our actions. You can reflect this on Sajna. I'm not going to do that. Respecting all people and their needs. Collaborating with others. She has to collaborate with the doctors. Striving for positive nutrition outcomes for people. Do no harm. Making this lady angry is harm by itself. And adhering to the standards of good practice in nutrition and dietetics. And there should be cultural competency. So, Dalia should be trained in how to counsel people, how to talk to them, how to approach them, and how to do proper dietetic consultation. Some of the components of these consultations are, number 1, the opening statement, putting patient at ease, welcome over, make her sit down, ask the lady, what can I understand? Why are you here today? We are here to plan together something about your issues. What is your ideas about your condition? What are your concerns in what we are going to do? What's your ideas about this? Do you have any fears from this meeting or anything that you would like me to elaborate on? And then she should go into the options of treatment that we have, the 6 options for everybody who have disease. Option 1 is do nothing and leave it for nature. And this is going to have consequences as the disease will go on this way, and complications is expected to come in some time later. Option 2, to do some lifestyle modifications, and this includes a healthy diet and include the diet appropriate to the disease, and it includes a change of lifestyle, the sleep pattern, using of drug, using of alcohol, using of other substance or certain kinds of food, and going for exercise, and going for anxiety relaxation. All of these are within the lifestyle changes, It includes the healthy food and includes the food properly adjusted for your condition and the timing of taking food. People who take food later are more likely to get more problems with their GERD. Okay, people who eat early in the morning are not going to get GERD and they do not eat late. So there is so many things to be discussed and counseling. On counseling, who makes the choices? The patient makes the choices, and the counselor will provide options. So she tells her there is 3 options or 4 options to minimize the amount of uric acid in your blood. Uric acid, when it precipitates, is going to cause you this pain that comes to the joints of your big toe and that may come to the joints of your foot or your knees. Okay, and she tells with empathy that I don't want you to suffer these pains. So we can either decrease the amount of the beans we are taking, or decrease the amount of the meat we are taking, or decrease the amount of other, medicines that are causing increase for this, which you are taking for your hypertension. I'm going to suggest your doctor to change the diuretics in the list of your hypertension. So these are the things which is going to be presented to her. And who will make the choice is the lady herself. Because if she doesn't make the choice and accept it, the advice is useless. Giving patient orders is useless. They have to be the ones who took the decision to take this kind of food or to take that type of food. So the role of the dietitian is to explain and to give the options and to show the consequences of each options, not to give orders or not to give directions. Then our dietitian needs training herself and needs teaching education on evidence-based practice. She should not give advice on selected areas that she is bound to, or that she is believing in, or that she was grown in its culture, because people have different cultures. So we should respect the cultural competency, and cultural competency includes the diversity of the patients who are coming to us. Now we have in Qatar more than 120 nationalities in Qatar. In my clinic, I see more than 50 nationalities. I have patients for more than 50 nationalities. And every week I'm getting new one from different country. Last week I got 2 from South America. They were new to the country. And I had to acclimatize myself and update my knowledge about their food, their habits, their beliefs, in what do they think about hypertension, what do they think about diabetes, and what is causing more diabetes in their food, and what is worsening the hypertension in their food. They are the source of information, not me. Not me. I would be the student here, I would be the learner here, and they should be given the chance to be the teacher. This is a very delicate and very difficult area. And it's very effective in treatment because food can reduce blood pressure and can increase blood pressure. Food is definitely affecting diabetes and dyslipidemia and hyperuricemia. They are definitely affected by food. So the main treatment is coming from the dietitian. So if the dietitian is moving to make all the people to be vegetarian, they're not going to be. So this is an area which is very difficult for our dietitians. We will do our best to help them to do it in an ethical way that affects all the things that mentioned in their code of ethics, which came from the International Federation of Dietetic Associations. Oh, our dietitians, are you happy with this? Are you happy with this? Would you like to comment on something here?
It seems as though they're happy, Dr. Isam.
Okay. I wish I can see their smile. Okay. Now we go to the pharmacists. Dr. Isam is used to prescribe many items of turbohalers and discuss for 2 to 3 patients every weekend. This is happening on regular basis, every weekend. It looks too much for each patient, not too. There is too much. Okay, here, there's a spelling mistake here. It looks too much for each patient. These patients are always praising the pharmacist for their kindness. Dr. Isam is a very senior doctor, and he teaches bronchial asthma to many professions in the healthcare, including pharmacy staff. What will you do as a junior pharmacist? Do we have pharmacists with us?
We do. We have lots of pharmacists with us today.
So,
Dr. Isam, he's prescribing many turbohalers for the patients. Appropriate? Is this appropriate prescribing or inappropriate prescribing?
this is to them. Regular basis, every weekend, 2 to 3 patients, both turbohalers and discuss.
Okay. So the question is, how should the junior pharmacist
What will
respond?
you do as a junior pharmacist?
Okay, so it looks like we've got some responses coming through. This needs to be discussed with Dr. Isam.
Okay.
Okay.
Who said it?
So this is Inas.
Okay, Inas.
Raj has said that he would speak to his peers. He would speak to his colleagues about this, his more experienced colleagues. Bina would ask the patient to see whether these are required or not, or whether the patient has a supply at home or whether these are needed. Hiba would discuss with Dr. Isam and would also discuss with her line manager. So Sarah as well would discuss this with the doctor, with Dr. Isam. Okay, so it looks like as well, Ali is saying that this issue should be dealt with lots of sensitivity, so you do not undermine the physician in front of the patient. So yeah, the physician should not be undermined in front of the patient. Okay, so it looks like the other answers are quite similar. That needs to be discussed with Dr. Isam around the rationale for this regular prescribing. Okay, now that's all the answers we have.
Okay. Those who said they will discuss with Dr. Isam, Dr. Isam is teaching asthma workshop every year to the pharmacists and to the consultants and everybody. He's the asthma man. And if you go and talk to him, he will tell you these patients are very busy during the weekdays and they can only come to the clinic during the weekends. They are working 12 hours a day. They are very busy people. And some of them are having very sensitive jobs that they cannot leave offices during weekdays. So this is the justification why I'm giving them this big doses or high doses of so many bronchodilators and inhaled corticosteroids. So Dr. Isam can justify his condition of prescribing, the rationale of prescribing for the weekend in this way. These people are busy very busy. They only come in the weekend. And I have been looking after them for the last 5 years. And he will say that Qatar is a country that lives on gas and oil. And there is a lot of burnt gases all around us. There is very big, number of cars moving around us and giving us a lot of gases. And there is so many trees around us giving us a lot of pollens. And these poor asthma patients cannot live, cannot breathe without having these high doses of inhaled corticosteroids and turbohalers, robos, the turbohalers, and the discus. So this is a justification of Dr. Isam.
So it looks like in response to this, Sarah has said that if she suspects that the dose of the prescribed inhalers is inappropriate and unsafe for the patient, she would not dispense the medications.
Okay. This is Sarah?
Yes.
Okay. Sarah, you are absolutely right. You have a professional duty to check on the doses and see that whether they are matching the maximum dose in the asthma guidelines that is registered in your system or in your corporation and approved there. We have the British Thoracic Society guidelines. You have the Scottish, the SIGN guidelines. We have the GINA guidelines. You have the American guidelines. You have the Australian guidelines. All of these are agreeing or have agreed into some sort of agreed amount of dosages for these medications. And you can check, if you use the system properly, whether these patients are taking every other week or are taking every other month or are just getting their medicines every 2 months. So if these patients are getting every week, then this is not the usual thing to happen. But if they are taking in 1 month, yeah, you're half and half. They are taking it on 2 months space time, then you're going to accept this, and there will be no problem with that. Maybe Dr. Azam is having 300 asthma patients because he was running an asthma clinic. And his asthma clinic, he is seeing about 40 asthmatic patients during the week, 2 clinics, 20 and 20. Those who fail to come during the regular clinics are the ones who will come in the weekend. That's the only way to catch him. So there is a possibility that this prescription is rational and this prescription is very right. And Dr. Azam is having very big number of asthmatic patients because he is running the asthma clinic. Any comments here?
There's no further comments, Dr. Isam.
Okay, then your suspicion went wrong on Dr. Isam. Now Dr. Isam will turn on you. He's going to file a complaint against you that when his patients comes and show you the prescription, when you look to the prescription, you change your face, you nod your head, you look right and left, and some of you are rumoring and saying yet another prescription of inhaled corticosteroids and turbohalers and discuss what is happening here. Patients have gone to Dr. Isam back after they finished, and they told him that the pharmacists are not happy to give us to dispel to us these medications, despite we were very nice to them, and they are talking to others in a bad way about you. Wow, wow, wow. What's happening here? So, any comments from our pharmacist? Okay. This is very hard. This is not easy to handle Because here you need to find the facts before putting any judgment on Dr. Isam or putting any judgment on the patients. You need to find the facts. And the one who finds the facts should be the one who can handle the computer system, and he should do that anonymously. Nobody should know who is he investigating or looking after. Okay, he should find the fact by himself, or he can confine that to the head or the line manager and tell him, I feel that I don't know how to do this, and I don't want to do something wrong. I do respect my colleagues, I do respect the doctors, but I think I should learn how to do this and make it as a learning exercise. But it has to be very confidential, okay, with your line manager, and then you go for fact finding. And then after you go for fact finding, you need to confirm it. After you confirm it, you talk to your line manager in confidence, and then you go for further depending on what you find. Okay. At some time, when you have enough facts and you have something, you can go for a learning exercise with Dr. Isam. Okay. And always put the good wills first, the good intentions first. But be aware that you have a professional role to stop Dr. Isam if he is doing some sort of malpractice, or if he is making business out of this, or if he is over prescribing in number or in doses to his patients. Because you, pharmacist, you are not grocery men. You're not working in a grocery. You're working in a pharmacy. You're working in a poison center. All medicines are poisons if they are used in the wrong doses. So you have a professional role to go for certain processes that is mandated by your profession. Oh, here comes the issue of integrity and nazaha. Integrity is a concept related to consistency in actions, values, methods, indicators, fundamentals, and various things that has been produced. A person with integrity means a person with honest personality and having a strong character. We don't want you, our pharmacists, to have a weak character. We want you to be honest about what you have learned, and we want you to be honest and loyal to your corporation, to the resources of the country that is we are all serving. Okay, so and you need to make sure that everybody around you is practicing with integrity, including Dr. Isam. And then we go to professionalism and areas related to it. Professionalism requires that the practitioner. This includes Dr. Isam, the pharmacist, and everybody else in the area. Social workers, physiotherapists, lab technologists, radiology technologists, dietitian, nurses, and everybody. Professionalism requires that the practitioner strive for excellence in the following areas, which should be modeled by mentors and teachers and become part of the attitudes, behaviors, and skills integral to the patient care. These are, number one, altruism. Altruism. Physician, I'm talking about physicians here, but this applies to everybody. Physician is obligated to attend to the best interest of patients rather than self-interest. My self-interest maybe is to please the patient, but the patient interest maybe is to tell him the truth and refrain from pleasing him through hiding the truth from him. And this is the same for all the others. Accountability. Physicians are accountable to their patients, to the society, on issues of public health, and to their profession. Physicians, pharmacists, physiotherapists, lab technologists, everybody should be accountable to their patients. Okay? Excellence. Physicians are obligated to make a commitment to lifelong learning. We all need learning, not the new nurse only, not the dietitian Sakina only, not the junior pharmacist only, not the lab technologist only, not the physiotherapist. We all need to go into lifelong learning. And this is why we are having this CPD. Thanks to Dr. Zakaria and his colleagues who are arranging the CPD. Okay? And this should be part of our lifelong learning. We have a duty. Physicians should be available and responsive when on call, accepting a commitment to serve within the profession and the community. We are paid by this community. We have been assigned and licensed by the community which we are serving. And the community is considering us as professionals because we are there and we are responsible for this community health. So the community is expecting us to accept the commitment to serve at any time, and we are going to be on call when the community needs us to do the duty. Honor and integrity. Physicians should be committed to being fair, truthful, straightforward in their interaction with patients and the profession. We have to respect these values and ethical issues. Respect for others. Physicians should demonstrate respect for patients and their families, other physicians and team members, including medical students and residents and fellows. Team members include everybody who is working in the healthcare sectors. So respect is part of the professionalism required by any practitioners to all the healthcare sector. Okay, there is qualities needed to achieve the qualities. And I'm getting this from the nursing body, okay? That critical thinking skills is highly needed as a quality or as competency that we should do this. I'm talking now on behalf of nurses that registered nurse must assess changes in the health status of patients, such as determining when to take corrective action and when to make referrals. Nurses have responsibility by their professions on taking decisions, on taking corrective actions, on making referrals of patients to doctors who are in charge of them or to other doctors if necessary. Also, another quality or another competency is communication skills. We all know that everybody needs to learn communication skills. Communication skills is the cause of more than 50 or 60% of the failures of the health care system. The third thing is compassion. I'm talking about nurses. Registered nurses should be caring and empathetic when looking after patients. Care and empathy is essential for all our healthcare professionals. Detail-oriented. We should not take the big titles and indulge in doing things and making decisions and changing things. We are health professionals. We are not Google men and women. Okay? Google men and women, they just take the big, sensationalism and they make actions. We are professionals. We have to go to the details of every condition we are looking after before making any changes. Emotional stability. Yes, our new nurse, was having very good emotion towards Mr. Ahmed as well as towards Dalia. But we have to be stable on our emotions. We should not be dragged by our feelings and emotions. We have to restrict it and make it rational to the point and do the right thing and not to be drained by that. We should have organization skills. We should know how to handle conflicts between people. We should know how to handle complaints. We should know how to handle our suspicion or this or that behavior or this or that patient. We have to handle it in a very, careful way. So we should know all the organizations, how do they work. And we should have physical stamina on doing the physical task on patient, on other people, whatever we are going to do. Ethics and ethical practice are integrated into all aspects of nursing care. The ethical principles that nurses must adhere to are the principles of justice, beneficence, non-maleficence, accountability, fidelity, and autonomy, and veracity. Justice is fairness. So I'm getting ethics from here and from here and from here, but still they can be applied to all the professions. Each professions will just apply to different areas, but the background and the reference for ethics is the same all over. Here I would like to say thank you for your following me during this, and thanks for your participation. Here, this is our picture about 4 or 5 months ago when we were doing the exam. This is myself here. Okay. And these are my colleagues from West Bay Health Center and from Hamad Healthcare Corporation. We were doing the students' exams in the medical college. This is Dr. Riyad, very active person. Many people here you may know. This is my references, the American Academy of Family Physicians, American College of Physicians, the British Medical Council, Medical Clinical Measures, the book by Robin C. Fraser, ethics papers from the RCGB, ethics papers from BMJ, ethics in medicine, University of Washington School of Medicine. They have very good work. Doctor's Dilemmas in Ethics, Doctor Communication Heart, my teacher Peter Tate, Oxford University Press on Ethics, Islamic Medical Websites, Manual of Family Practice, and Robert Taylor. There is so many other references you can go to. Okay, clear your mind. Okay, and I will just stop here.
Thank you very much, Dr. Aysam. Very enlightening presentation, very enjoyable and interactive as well. So thank you very much for taking the time to present to us this evening.
Thank you very much. I'm very happy to join you, and I'm very happy to answer any questions.
Okay, so we do have some time left, so I would allow our attendees to post their questions in the chat.
And if anybody has a dilemma, he is welcome to present it. I'm expecting some dilemmas from the audience.
Sure. So in the meantime, while our participants are thinking about their dilemmas, I'm just going to share the QU Health CPD website for those attendees that came a little bit late and didn't see it at the start. Okay. So following today's event, if you would like to claim your certification, this is the link, the CPD evaluation link, and it will be open at 8 p.m. today for the next 7 days. And this is the way that you can claim your CPD certificate. Our next session will be on Tuesday. This is when we'll be starting our 6-part diabetes series. So please join us on Tuesday at 6 p.m. And then this will be a once weekly event every Tuesday for the next 6 weeks. We do have one additional event that we added to our calendar today, and this is on Wednesday, the 10th of March, and we are presenting on medication waste, implications, challenges, and a direction for the future. Okay, so that's the information regarding our up-and-coming event. Let me just check on the chat. In terms of dilemmas, so our participants are giving you thanks, Dr. Aysam, but they very enjoyed your presentation. Okay, so there is one question here, and this is from actually I won't mention the name. So I sometimes find that the environment in which I work in is not always adherent to professional ethics. Can you advise on the best actions that I should take?
Okay, this is a good question. That you looked around you and you found that there is the environment you are living in or the work culture does not show concern about ethics, and they are, if I say, they are somewhat loose or not tactful, not rough, not exactly following, the ethical boundaries here. The first thing to do here is you yourself learn more about ethics. Okay? And the second thing that you start a way of teaching your colleagues and learning with them how to observe the ethics in this area. And if this could be taken as a need for education or a need for training, and then the CPD office or the workforce training of your or the human resources development department of your corporation or the area will recognize this, then they should prepare a training program for it, including lectures, workshops, symposiums, and so on. So education, 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 raising the awareness, raising the awareness, raising the awareness, providing this education. Don't just ask other people to do it. They cannot do everything for you, but you ask them to come and to do it with you, not to do it for you. Okay, you do it with them. So this is what you do. Number two is that when you encounter something about this, you take it as a learning opportunity, not for yourself only, but for yourself and your colleagues. And this is related to the culture. And if the leadership is willing to do the corporation role by empowering people to practice ethically and by providing education and providing support to the ethics, culture, and environment, as you said, then that will be another good action to do.
Thank you, Dr. Aysam. Any further questions from our participants? There doesn't seem to be any further questions, Dr. Aysam. So I think I would like once again to thank you for your efforts and spending the time with us this evening. And thank you also to our participants who've taken part in the discussion and contributed their ideas. I think these events are much more rich for everybody when there is that greater interaction. So thank you for facilitating those activities.
How many people we have now?
We have 54 people.
54 people. Okay, so I'm getting new 54 friends in the university. Hello, dear friends. Assalamu alaikum all.
Alaikum salam.
Alaikum salam. I'm happy to contribute with any area in the soft medicine or in hard medicine in the coming in the coming time. Okay. Very happy to participate with you. I'm thankful for your encouragement, Dr. Zakaria, and I'm thankful to the learning I had from the previous two lectures by this marvelous group. We were putting a lot of ethics science and have done a lot of effort there. So thank you, my teachers, my colleague teachers, and thank you to attendees for your participations and giving many ideas which I'm going to add to my slides. Thank you.
Thank you very much.
Thank you very much.
Good night, everybody, and enjoy the rest of your evening. Assalamu alaikum.